let me firstly express my excitement and deep gratitude for your visit to Botswana. I know you've always had a taste of Botswana in terms of our presentations. Leonard, you had a taste of Botswana on the ground when you came for site visits and touching base with Ministry of Health. I'm very excited that you could make this. You know, we have always wanted this to happen as early as 2019, but we couldn't because then we had an election. And we didn't want to go into a launch only to find that I am not the First Lady.
Okay.
Then COVID visited us. Then finally this moment came. We are going into another election. But I suppose this time we all have a very good feeling that we will win. I suppose you coming here means that we will win.
Yes, definitely.
So
we give very good luck always. Yes.
But let me just go back and thank you for this very, very strong relationship that has been growing stronger, if anything, over the years. You have rolled out your, what I'd call your flagship and sort of programs in terms of the scholarships. You've kept pretty much to your educating Linda, but you've allowed us and given us leeway to also roll out what we wanted on our side. A typical one being a country that has been plagued by gender-based violence. You contributed those machines, and you'll hear some testimonies. And tonight, you'll meet some beneficiaries.
Oh, wow.
In distributing them, we pretty much went to what I'd call the poverty belt in areas where there is poverty. And we would find that poverty and GBV, in some ways, actually had a relationship because these women depend on these men, regardless of the abusive relationship. We thank you also for the luminaries who always have been hosted so well. That's why we really try to go all out because you really outdid yourselves all the time. I mean, all the luminaries we've attended, they left memories. And it doesn't only go for me, but my staff or the guests that have come, that I've traveled through. But I'd just like to thank you for that relationship that's growing stronger. And going forward, we are really hoping that we could do more on the infertility side.
Of course.
But as we've mentioned in the past, the fact that lack of data, and it's still very sensitive. And Botswana is a very young country when it comes to even services around infertility. But Ministry of Health will speak to that. But I want to thank you very, very much for scholarships. I think scholarships for me it has really been key. Rasha, we know a healthy nation is a productive nation, and you've touched on the very specialties that are relevant. It wasn't any specialty that you were touching on. But thank you, and I'm looking forward to this evening, to the cocktail, which is primarily for networking, as I mentioned last night. That we don't want where it's parachuting. You jump in, launch and leave. We thought you jump in, meet people tonight, real people that we speak about at the luminaries, or real people that you read about.
Yes.
And then just the people of the cocktail dinner and then the lunch. We're looking forward to it. The president will join us.
It's the honor. This is a very, Dr. Frank is so excited about it.
His Excellency will join us tomorrow for just 1 hour of the program. Because we've just come out of a primary election actually this weekend.
All right.
Yes.
Great.
So
great.
His Excellency, and then there's a
Very
state
busy.
next week. So His Excellency is very, very busy. But he couldn't miss it. Because I've spoken so much about
Thank
Rasha.
you.
And
Yeah.
Professor.
Thank you very much.
He finally wants to meet you.
Thank you. I'm so honored. I'm so
Merck
honored.
Foundation.
And I
Because
hope I
remember
bring
you
you good luck.
cycled with us.
Yes. Sorry?
You cycled with us.
Yes, you remember?
Yes.
And it was in his
Virtually.
birthday, also his birthday.
Exactly.
Yes,
That's what
I
we
remember
mentioned.
that very much.
So you really
And I have this hat.
Yes,
That's
exactly. So
great.
the Excellency will join us, and then the site visits also. We are very excited that you can go to the site visits because we mentioned Merck Foundation at both site visits. So finally, they'll see the people behind Merck. They have met Leonard, by the way.
Yes, I know.
So they will meet
Yes, us.
the rest of the team. And there are special teams because the school, special needs children, and then in Old Naledi, it's the low-income area in our city. So that's why we thought also we should give these
Definitely.
Otherwise, we're excited. I wish you had more time here.
I wish I had more time as well, but I know that you are very busy now. Your Excellency and my dear sister, I am very proud of what we achieved from 2019 when we started the partnership. And what I believe is that the delay of the physical launch of our program is meant to be, because now we have a lot of milestones also to celebrate. And you need to inform the public and the whole government what great work you have done, and the follow-up that you have done even during Corona. You never miss an online event. You never miss an online follow-up or meeting. You're always with me on the phones to follow up on the programs and ask for things for Botswana, and more scholarships, more educating Linda programs, sewing machines you follow up with by yourself and GBV initiative. So I was really proud, and I also with your ideas. You always have new ideas, and we implement it in the luminaries. So that's why I remember you missed only one luminary, which is the election year.
Yes.
But we congratulated you in the next day during the Mafli,
yes.
When you won, because it's the second day.
Yes.
I think this also time it will be election time, but you promised me that you are going to come at least one day.
Yes.
Okay.
To Tanzania.
To Tanzania.
Yes.
So we can celebrate again the winning.
Yes.
Yes, and it has to be our ritual. So we celebrate the winning in luminary all the time.
Exactly.
Yeah.
Yes.
So it's a good sign. It's a good sign. I believe in a very good sign. Another thing also, Your Excellency, I'm very excited about the beneficiaries of the sewing machines, and also the beneficiaries of educating Linda for the bicycles and the scholarships. This is very close to my heart as well as yours, I know, and this is what we met in the middle, that we're really interested in both things. Of course, I wanted to come earlier, but I know I wanted always to respect the protocol. I don't want to also waste your time because you are busy this. So, I mean, I think when I send the team members to follow up, it will be more low-key, low profile, but the work will be done. And then as soon as you win, I will come and visit you again.
Great.
Definitely, we'll
Great,
spend more time.
You have to do the Delta now.
The what?
To do our Delta.
What
the safari.
Oh, the safari, yes. I want to do it, but not in the winter. Because I want to do it a little bit in the hotter climate, because I am.
No problem.
I get ill when in the winter. I don't know. I was not used to winter for 35 years, because I live in Dubai for 35 years, so I don't have winter. So the winter for me is like my body is not adapted. Yeah, my body is not yet adapted to it. Okay. So that's why I avoid winters everywhere. Yeah. So, and other things as well, I want to thank you very much for the generosity. We are honored to have the President of Botswana and your dear husband with us. I know that he is a very good support of you, and this is the main role model of women empowerment. So this is amazing. Professor Frank is looking forward to meet him as well, and to meet you, and he is coming all the way from Germany too, especially for you.
Yes. Thank you so much. Actually, we've invited the German embassy also.
Oh, great.
So that because of the German link,
yes.
Confirmed? Or are they sending a representative?
No.
Okay, I hope they can send a representative. Yes.
And of course, for infertility, as you know, that the very big part of the scholarships for the sexual and reproductive care, and also fertility specialists and embryology, although we still need more. So wherever you have candidates that you find nationwide, that it would be good to help women and fertile couples to have access to better health care, we are going to send them immediately priority for training and the diploma course. So as soon as you decide, let me know, definitely. So, but again, as 45 scholarships was a really good number. I wanted only to ask, how many physicians in Botswana? Do we have a number?
I don't have the number, but it's more than 1,000.
So I mean, like 45 scholarships compared to the 1,000 is really a good number, but still we want to increase that number.
Yes.
So you can also highlight this in your speech, Your Excellency,
Okay.
that it is actually a good percentage for 2.6 population, and because, for example, in Kenya and Uganda, we have, especially Kenya and Ghana, we have like Kenya 45 or 50 million, but we have provided 160 scholarships. So comparison to the population is a very high number. Yes, yes, yes.
The proportions, yeah.
Yeah,
That's true.
yeah. Actually, we should say something about cancer, and because since we are wearing pink, we can make a little bit advocacy about breast cancer. Yes, yes. So we can have few words that we would like to encourage all women with the breast cancer to be more stronger and be the heroine and fight cancer, and we will fight with you together every day.
Exactly. But then I suppose to the rest of the women, we should say screening.
Yes.
Early detection is the way to go.
Prevention better than cure.
And we do have the tools if it's detected early.
Yes.
Then the greater chance. And the Ministry of Health recently wanted to roll out a campaign for cervical cancer, but it's just that they delayed. And one interesting dimension that we'll bring in there is that the men.
Yes.
We need our brothers also, our
Prostate
sons,
cancer.
to also, to even encourage us.
Yes, yes.
As we go for screening, they take us there.
Yes.
They should put reminders also on the
Calendars.
for screening.
Yes, definitely,
for
definitely.
breast cancer.
Yeah, definitely. Maybe also encourage them to screen for prostate cancers, because also it is very important in early detection.
Exactly.
So for all of us as a happy family, let's support each other in all aspects of health and well-being. Yes. Thank you very much.
Thank you.